name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with Fertility and Pregnancy, letter C. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and metabolism, and homeopathic remedies for infections, infestations, and the immune system, issues surrounding fertility, pregnancy, childbirth, postnatal problems, then homeopathic remedies for infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Natrum people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with fertility and pregnancy, starting with the letter C. Every month during a woman's reproductive years, a ripe egg is released from her ovary and enters the fallopian tube, and the mucus at the entrance of the womb at this time becomes less sticky. If intercourse takes place, millions of vigorously swimming sperm make their way through the mucus into the womb and into the fallopian tubes, where they congregate around the egg, causing it to spin around with the movement of their beating tails. Eventually, one sperm penetrates the egg and the nuclei of sperm and egg fuse, and the process of cell division begins. The fused nuclei split into 2 cells, then 4, then 8, then 16, all containing the 46 chromosomes that will create a new and totally unique human being. 7 days after fertilization, this ball of cells embeds itself in the wall of the uterus. At 20 days, the placenta begins to form. At 30 days, the spinal cord. At 6 weeks, the heart. and by 13 weeks, all the body organs are formed. At 5 months, the baby can be felt to move. At 6 months, the lungs become functional and the nostrils open. At 7 months, the baby should be in the head-down position ready for birth. A full-term pregnancy usually lasts 38 weeks, counting from the moment of conception to the time the baby is born. Conception usually takes place halfway between periods, if the woman's cycle is 28 days and regular. However, since many women's periods are not exactly 28 days, pregnancy is usually measured as being 40 weeks from the first day of the last period. Common pointers to pregnancy are missing a period, more than usual tenderness and swelling of the breasts and darker nipples, nausea, tiredness, a frequent urge to pass urine, and sometimes loss of appetite or cravings for unusual foods. To confirm the pregnancy, the woman should have a pregnancy test. The chances of having twins are about 1 in 80. Identical twins develop from the same egg and share the same placenta. Non-identical twins develop with different eggs and have a placenta each. Only 3 pairs of twins in every 10 are identical. Triplets are much rarer, only occurring in 1 in every 6,400 pregnancies. Once it is determined that the woman is pregnant, it is important for her to go for regular prenatal checkups. Prenatal care is important since it allows them to find out at an early stage if there are any problems. An ultrasound, which is a sound picture of the baby in the womb, is thought to be harmless to mother and baby, and can be used to monitor the size, shape, and position of the baby at any stage of pregnancy. Amniocentesis, which is the taking of a sample of the amniotic fluid around the baby, is usually carried out between 16 and 18 weeks, but only if a previous baby has been abnormal or there is a family history of congenital problems, or if the mother is over 35. Here in brief are some of the do's and don'ts of pregnancy. Treat your baby as a person from the word go. Moderate exercise such as swimming or walking in the fresh air are very good, but anything that involves repeated compression of the spine, such as horseback riding or trampolining, should be avoided. Always keep 25% of your energy in reserve. Do go to prenatal classes. They will teach you what to expect and how to breathe in order to cope with the pain during labor. Don't wear tight clothes and get as much sleep as you can, and avoid late nights. Also, don't sit in hot tubs for too long. 10 minutes is about the maximum, especially if you faint easily or have a tendency to bleed. Avoid serious traveling if you can, especially if you have a threatened miscarriage, or there are complications, or you suffer from travel sickness. Most airlines do not like you to fly after 32 weeks or so. So if you must fly, check with the airline first and stop working before 28 weeks if your work is very strenuous. The expectant mother needs to eat a healthy, well-balanced diet with an increase in iron and calcium foods, and also a modest increase in protein intake, preferably in the form of oily fish, nuts, seeds, pulses, and whole grains. With generous helpings of raw vegetables and fruit, will help to guard against constipation. Tea, coffee, and alcohol should be avoided, as well as chamomile tea, especially in the latter stages of pregnancy. Homeopathic remedies during pregnancy. During the first 3 months of pregnancy, the most vulnerable time, you should avoid all medication if you possibly can. That means prescription drugs, recreational drugs, over-the-counter preparations from drugstores and health food shops. There is no evidence that homeopathic remedies cause any problems during pregnancy, but to be on the safe side, they should not be taken in potencies less than 6C, except for tissue salts. It is probably best to avoid low-potency apis altogether and take 30C if you need to. For minor complaints during pregnancy, homeopathic remedies should be tried first. If you feel very unwell, see your doctor before taking anything else. Cardiovascular problems during pregnancy. Pregnancy puts extra strain on the heart and circulatory system. It is not uncommon, for example, for heart murmurs to develop during pregnancy. These represent slight alterations in blood flow through the heart and are usually not serious, but your doctor will probably want to investigate. If you have an existing heart problem, rest as much as possible during pregnancy. Don't smoke. Learn some form of relaxation or meditation. If you have a congenital heart defect, see your doctor. They will probably send you to see a specialist. If one of your heart valves is damaged, antibiotics may be prescribed to prevent infection, which could prove fatal. If you are unable or unwilling to take antibiotics, take 3 doses of silica 6C for 5 days out of 7 throughout your pregnancy to relieve the strain that delivery puts on the heart. You may need an episiotomy, which is an incision in the vulva so that the baby's head slips out more easily. High blood pressure during pregnancy can be due to general anxiety. Constitutional homeopathic treatment, rest, and relaxation will most certainly help. If high blood pressure is accompanied by headaches, blurred vision, nausea, vomiting, intolerance of light, and swollen ankles, the chances are you are developing pre-eclamptic toxemia, so see a doctor within 2 hours. Palpitations are not uncommon during pregnancy. They are a sign that the heart is having to work harder to pump an increasing volume of blood. For some information, see my video on heart palpitation. Specific remedies to be taken every 2 hours for up to 10 doses. Palpitation onset sudden after a shock of some sort, fear of dying. Use Aconite 30C. Palpitations brought on by heat or rich fatty foods, general weakness. Use Pulsatilla 6C. Palpitations worse at night, especially when lying on the left side. Use Lycopodium 6C. Heartbeats seem to shake the whole body, constricted feeling in the chest. Heat and sympathy make discomfort worse. Use Natrum 6C. Cervical incompetence. Cervical incompetence is a weakness of the cervix, which causes it to open up at some time after the 12th week of pregnancy and causes a miscarriage. The weakness may be due to damage caused by previous deliveries or by D&Cs, which is a stretching of the cervix in order to remove a fetus, fibroids, or cysts that are forming in the uterus. The standard treatment is a minor operation in which a suture is put around the cervix, like a purse string, and tightened. It is removed at 38 weeks unless labor begins earlier. Constipation during pregnancy. The hormone that maintains pregnancy, progesterone, decreases the tone of the bowel muscles, and the growing fetus also presses on the large intestines. The net result is delayed transit of feces. If constipation does not respond to the homeopathic remedies or self-help measures below, see your doctor. On no account take laxatives. They may cause miscarriage or premature labor. Specific remedies to be taken 4 times daily for up to 14 days. Dull headache, feeling of fullness in the rectum, frequent but unsuccessful straining to pass stools. Use Nux 6C. Hard, knobbly stools, never emptying bowels properly, piles or inflammation around the anus. Use Sulphur 6C. Hard, dry, burning-looking stools, especially during morning. Discomfort made worse by movement and cold drinks. Thirst for large quantities of fluid at infrequent intervals. Use Bryonia 6C. Large, hard stools. Rectum feels as if there is a hard ball inside. Pains that shoot up rectum. Use Sepia 6C. No desire to pass stools unless rectum is full. Even soft stools are difficult to pass. Use Alumina 6C. Hard, small stools passed with difficulty, never emptying the bowels properly, ineffectual straining, passing a lot of wind. Use Lycopodium 6C. Self-help. Drink more fluids, increase the amount of fiber in your diet, take more exercise, and never suppress the urge to pass stools. If these measures fail, Try taking psyllium husks once a day to begin with, then 3 times a day. The correct dose is 1 teaspoon of husks stirred into a cup of water and drunk immediately, followed by 2 more cups of water. Cramps during pregnancy. Cramps in the calves are common during pregnancy and very exhausting if it occurs at night, as well as during the day. Specific remedies to be taken every 4 hours for up to 7 days. Cramp worse in the calf, but relieved by warmth and walking. Use Veratrum 6C. Cramp in calves and soles of feet. Numbness or pins and needles in the arms and hands. Rest relieves the discomfort. Cold makes it worse. Use Nux 6C. Cramp mainly affects left leg, but wears off when pressure is applied. Use Colcynth 6C. Legs feel cold and numb, but better for cold applications. Use Ledum 6C. Self-help. If the cramp is persistent, take magnesium phosphate tissue salt as well as one of the remedies just discussed. Cravings and aversions during pregnancy. Strong food likes and dislikes during the first 3 and 4 months of pregnancy are very common, but not compulsory. If the health is good, there's nothing to worry about. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.